says 11 a.m. So let's go ahead and get started, and I can let people in as they join us. So welcome everyone. This is a great turnout. We have 11 participants for our very first Wellness Wednesday. We're happy to have everyone. Just a little introduction. My name is Kylie Wyeth, and I'm with the Healthy Aging Association. I'm a health educator, and we do have a guest speaker today, Dr. Bob McGrew, joining us. And we're going to be talking about medications and how they relate to falls. So just a little housekeeping here. I do want to let you all know that this Zoom meeting will be recorded. We will be posting it on our YouTube channel and our Facebook page. We do have a Young at Heart class going on right now, and some of them weren't able to make it. So we want to make sure that everyone can watch it and get in on this good information. And then if you feel uncomfortable being recorded, feel free to turn off your camera just for a little bit more of a privacy. All right, letting some more people in to join us, a total of 13 people.
Wow.
All right. So a little bit about the Healthy Aging Association. We're the ones putting on this Wellness Wednesday. We are a nonprofit organization. We actually have our director on with us right now, Diana. So welcome in, Diana. And our mission is to help older Americans live longer, healthier, and more independent lives by promoting increased physical activity and sound health and nutrition practices. So thank you all for being a part of the Healthy Aging Association and joining in on our Wellness Wednesdays. All right. So a little bit of startling statistics regarding falls with older adults. So as the CDC has stated, every 11 seconds, an older adult is treated in the emergency room for a fall. And every 19 minutes, an older adult passes away from a fall. So I would definitely consider those some startling statistics. And if we look here, it says 20% of those falls result in injury. That can be broken bone, maybe a bump, scratch, anything. And then falls are actually the leading fatal injury in the most common non-fatal trauma. So it's really important to prevent these falls. Looking at these statistics, it's actually kind of scary. All right, and here, nice and big, another stat from the CDC. So back in 2014, 1 in 4 older adults reported to having a fall. So that's quite a big number if you ask me. And just a little bit more statistics here on falls. More than 7 million of those falls required some type of medical attention and being restricted from your activity for at least a day. So some falls can result in just a bump or a scratch, and some result in, unfortunately, death. So it's very important to prevent those falls with all these statistics from the CDC. And today we're going to talk about medications, and we do have Dr. Bob here to go in more in depth, but here we're just going to see that it's really important to talk to your healthcare provider. And today we have Dr. Bob to answer any questions, so we are very privileged that we have him join us. It's important to review those medications because taking multiple different medications can increase your risk for falling. Maybe your medication has a side effect that causes you to get dizzy. And it's always important to discuss with your doctor your history of fall. So if you've have had a fall, it's important to let your doctor know right away so they can look at if it was caused by your medications. And like I said, Dr. Bob will definitely go more in depth in all these topics. All right. And then you can work together with your doctor and pharmacist to review each of your medications. They can sometimes combine medications for a certain health condition to help with those side effects. And they can also reduce the dose, which can help with the side effects as well. So that was just touching on a little bit of points here, but I am going to hand it over to Dr. Bob now, where he's going to go in more depth about medications. And I just want to let you know, towards the end, we will have time for question and answers. So we'll just let him go through his slides right now. It's all yours, Dr. Bob.
Okay, thank you. Thank you, Kylie. I appreciate that. Great introduction. Let me tell you, probably all of us have had falls, right? Some of us probably have been injured by falls, and I know I have. So I just wanted to share, this isn't just a theoretical concern for me. Just a couple of months ago, I was walking in the dark, trying not to wake my wife up after she'd gone to sleep, tripped over a bar that was on the floor and went down. That was just a month or two ago. So not really caused by meds. I wasn't on anything that could cause it, but just, it's a hazard. And I really think our balance is not quite as good as we probably all agree, who are, at least those who aren't Kylie attending today. So how do medications add to that? Well, medications and health conditions can be a big problem. Another way that falls touched me personally is we lost my mother-in-law at age 83. She was developing some dementia, but still functional, living on her own. And she tripped over something in the sidewalk, went down, hit her head, had a brain bleed, died a couple of weeks later. So for my wife and I, this is very near and close to home. She was on a blood pressure medication, and I don't even remember what else. But the point being that that age plus medications can be a very serious combination, as we all know. So I'm just going to highlight 3 or 4 classes of medications. And there's a lot to look at this. And I don't expect you to remember anything particularly except the general category of medications, and we have to watch out. So all of us remember Benadryl. Most of us have taken diphenhydramine, which is Benadryl. If you look up at the top, you can see those, you can see the names. My wife still takes chlorpheniramine at times. So I've tried to talk to her about not taking that. That's called chlortrimeton. We'll remember that brand name. Hydroxyzine can be used for allergies and for anxiety. So these often cause drowsiness, and they've been shown to cause next day difficulty thinking clearly and imbalance. So we're taking old-fashioned, allergy pill that usually has worked for us in the past, but not thinking that now that we're over 65, they're more likely to make us drowsy, more likely to make us fall. So some of the new alternatives, if you look down on my slide, it says better alternatives. We have Claritin, Clarinex, Allegra. They're rarely sedating, but it's not never. Interestingly, my wife gets sleepy with Claritin. I've never met another person in my life who gets sleepy with Claritin. So we're all different. We've all got to check, but those are better alternatives. Those are all over the counter, as we probably know. And then Zyrtec and Xyzal, which are over the counter, are better alternatives. But interestingly, some people get sleepy with them. And I get sleepy with those, but not with Claritin. So we're all different. We just have to be aware of even over-the-counter medications. Next slide, please. So here's another medication that's very common in the elderly. And the problem is when we get older, we don't sleep as well. So we don't sleep, we'll wake up at night to go to the bathroom or just between sleep cycles. Our sleep goes deep for a half an hour, and then we come back up to a lighter sleep for a while. And during that time, old folks wake up. So a lot of us, like sleeping pills. They're hugely used in people over 65. So if we look up at the top, this is one type of pill that's used for worry and anxiety and sleep. And we're familiar with a lot of these names: Xanax, Librium, Klonopin, and Valium are very well known. But the increased falls when people get up to use the restroom. And during the day, people can be a little more drowsy, which means you trip over the carpet or you trip over the grandparents' toy, because you're just not quite as aware. So, and also these are habit forming too, which a lot of people don't know if you take them regularly. So those are drug category where you really have to watch. And again, even if you don't take it, if you have a friend who tells you, well, I take my Xanax and it just calms me down, you have to say, well, let's look at your house. What can you trip over? I heard those are a little more dangerous when we get older. And let's go ahead and go to the next slide. So while these are not prescription meds, they're certainly self-medication. So I just wanted to remind people about this. People take them to relax, take them in the evening. Of course, we know they interfere with concentration, and we know marijuana does also. And then it turns out we get these drugs out of our system more slowly. So one alcoholic drink at age 35, if you're a woman, puts you right on the edge. If you're like Kylie's size, right at the edge of being illegal to drive. But a man, not usually, unless you're very small. But at 65, 70, 80, one drink can put you to the edge of being illegal, and certainly to the edge of having enough alcohol to fall, even if you're a guy my size, 170 pounds or 200 pounds. So the point is, we don't get rid of these as quickly. And then one thing I didn't realize is if you drink a drink later at night, and pot also interferes too, while you go to sleep more easily, you wake up around 2 in the morning and it's hard to get back to sleep from 2 to 6 or 7 in the morning because of the effects of what the alcohol gets broken down into on the brain. Isn't that interesting? So some people who drink to go to sleep actually are making their sleep worse for the last 2/3 of the night, but they don't realize it. Okay, let's go on, Kylie. And here with the antidepressants and antipsychotics, again, these are ones that we don't think of often easily as making it more drowsy and more easier to fall. As you see, I put down a bunch of different names. A lot of us have heard of Elavil, Celexa, Prozac, Paxil, Zoloft are all common antidepressants, many millions of people on these. And the numbers afterwards are the percentage of people who feel sleepy or drowsy after taking. So while Prozac often makes people feel hyper, 11% of people feel drowsy. Again, we're all different. You can see Paxil pretty commonly makes people feel drowsy at 24%. And then we have some medicines that are kind of used for people with extreme anxiety. And sometimes people with other mental health issues. You can see Zyprexa, up to 40% of people are quite drowsy or get sleepy, a major hazard for falling. And again, I know if you ever hurt yourself badly falling, which I have, I tore up my knee a few years ago, 10 years ago, falling, playing Frisbee football, right? I don't want to fall again. I'm going to really watch any of these medications, including ones like antidepressants that we don't normally think about. Okay, Kylie, next one. Now again, sleeping pills are such a common cause of falls that I wanted to go over those again. So we're going to start out with the idea that it's much better not to take sleeping pills. And this is, even if you guys don't take sleeping pills, think about your friends. We all know older folks who maybe will tell us, yeah, I just have to take a pill to sleep. And what the problem is that taking any sort of sleeping pill or alcohol or marijuana, they all disrupt what we call normal natural sleep. So you may be unconscious for 7 hours because you took a good dose of that, but you're not getting good sleep. So what does good sleep do? Good sleep helps our long-term memory, and I need as much memory as I can get. I don't know about you guys, but I'm starting to forget names at times. So we need to really get good restful sleep. So sleeping pills wipe out the restful part of sleep. You're unconscious, but your brain is not doing what it needs to do to have good memory. And it also, interestingly, that time from about 2 to 6 or 7 in the morning facilitates emotions and stress and anxiety getting resolved. And if we're not in good, natural, restful sleep for 7 hours or more, going into about 6 or 7 in the morning, that isn't happening as well as it should. It can make us more anxious. Isn't that interesting? So even sleeping pills are counterproductive, except maybe occasionally. If you're really, really upset, okay, but not as a regular use. And next one, Kylie. So yes, we're going to go over restful practices. Kylie, do we have a sleeping pill slide? I don't see that.
No, I think it went from this one to this one.
Okay, yeah, we have a sleeping pill slide in there. All right, that's okay. So sleeping pills, let me just read the names. Restoril, which is temazepam, Lunesta, Sonata, Ambien, or Cinequan, and Trazodone. Those are common brand names and names of sleeping pills. Well, the also, interestingly, every one of those is possible to cause a car accident the next day, because in some people, again, particularly women and smaller men, there's enough medication left over that if you're out driving, more chance of a car accident, particularly with Ambien, which are the most commonly used sleeping pills. So we need to be really aware of that. And now we're going to go on to healthful sleep practices. So you may say, well, gosh, my friend, my brother, my sister, myself, we can't sleep without pills. What are you talking about? This is a common thing I heard as a doctor. I can't sleep without it, doc. You got to give it to me. So here's the problem. Most of us have not tried these other possibilities. Let's finish with this. Cognitive therapy, which is done by a practitioner, usually a psychologist of some type, is the most effective method. And what they do is, it turns out we all have bad habits when it comes to sleep. One of the worst habits is starting to think about your day tomorrow, either when you're going to sleep, what do I have to do tomorrow? Or when you wake up in the middle of the night, get back in bed, oh gosh, yeah, that's right, I'm going to do this tomorrow. So that anxiety about thinking about tomorrow actually kicks off adrenaline, and slowly you just wake up. And now I'm awake. Oh no, I'm not going to sleep. I got to get up in the morning. This is learned anxiety. We learn to be like that. So you can unlearn that. You can actually unlearn that. You can learn how to actually rest without having to go to Tibet and climb up to find a Buddhist monk. We can learn those practices. So that's a lot about cognitive behavioral therapy. It's about addressing your fears, letting go of the pills, if that's what you're on, or just helping you have positive habits of thinking that let us rest and relax. Now, here's a couple other things. Caffeine. In the summer, a lot of us drink caffeinated beverages, particularly iced coffee, iced tea, that kind of thing. I tend to drink it afternoon. Well, caffeine takes 8 hours to get half the caffeine out of your system, 8 hours. So if I drink it at 1 in the afternoon with a late lunch and go to bed at 10, I've still got 40% of the caffeine that I drank at noon. Does that make sense? Well, If I drank 2 glasses of iced tea, that's plenty of caffeine to keep me awake. And when you're older, that happens more. That's, again, you don't get rid of the caffeine as fast. It's harder to go to sleep. This contributes to anxiety. So let's think about that. I'm not saying not to drink a cup of coffee or have some tea, but I'm having my tea. This has a little green tea in it. I'm having it in the morning to help wake up, but I'm going to stop at noon. And green tea is much less caffeine than coffee, so I can have a couple bags of that in the morning. Okay, so that's that. Now, alcohol, we already went over. Within 5 hours of bedtime, 1 drink is worrisome, and particularly a nightcap, which is within 2 hours of bedtime, is really going to interfere with your sleep. Even just 1 regular sized drink, which for some people is not that much. Now, remove screens from the bedroom. Here's another big issue, is if we've got a TV or a phone or a tablet lying there at night, and we wake up, we're likely to grab it. Or if we go to bed, a lot of people watch the 10 o'clock news. Frankly, that's the worst thing you could possibly do, is watch the 10 o'clock news, because they always lead with a traffic accident or a shooting or something. And again, we've got to relax before bed and wind down. So turn off the screens. Don't bring your iPad into the bedroom with you. If you have a TV there, either get rid of it or just get in the habit of not using it at night. Very important to kind of help give us the calmness we need, even if we wake up. Stay calm, think about positive things, go back to sleep. So here's another big issue. Regular bedtime and wake up times are all the sleep science says it's good to be consistent, even on the weekend, even on vacations. Sleeping on the couch in the evenings, big habit a lot of people have, and lying in bed over 20 minutes. People get anxious and upset if they lie in bed and can't sleep. So get up, read something really boring. And medical textbooks are fantastic for going back to sleep. So write something really boring or something enjoyable and uplifting, and that's going to help you. Okay, Kylie, yeah, we've got, one more slide, I think?
Yes.
Yeah, so, right, perfect. Avoid daytime naps. So this is not just sleeping at night and then getting up and going into the bedroom to go back to sleep, which is problematic. Daytime naps are okay if you can go back to sleep easily. But if you have problems sleeping, your body needs to be really tired when you go to sleep. So, and most of us wake up to go to the bathroom after 2 or 3 hours. You gotta, if you've had a nap, your body may think, okay, I don't need to go back to sleep. Does that make sense? Now, if you can take a nap and you still go to sleep fine and stay asleep, great. Mentally slow down. Again, we have to wind down before bedtime. So again, this is even watching TV in the living room. If it's exciting, if it's the news, if it's an action adventure, it's hard to get rid of that adrenaline. So we need to watch something that's relaxing, comedy, something like that, or read something that, again, that's relaxing. And then get rid of the clock. Clock watching, it creates anxiety. Play relaxing music or white noise, that's fine. Yesterday I took a nap after a bad night. I took a nap playing music, and I recommend classical. And then have your meds and OTC supplements checked by pharmacists. Now we just talked about having your meds checked to make sure they don't make you drowsy or impair your conscience so you fall. So why in the world am I telling you to have your meds checked to see if they keep you awake? Well, those same antidepressants I just showed you, they can actually make you feel a little hyper and make it harder to sleep, particularly if you're taking them at night. So again, some people get sleepy, some people get anxious with the same med, and your pharmacist or physician are going to know that. So that's what I'd leave you with, those thoughts.
All right. Well, thank you, Dr. Bob. We much appreciated all that valuable information, and we will have a few minutes at the end of the presentation for any question and answer. But let's move on a little bit here. So overall, preventing falls, here are some of the things that we look at. Medication management, exercising regularly, which we do have a Tai Chi and Young at Heart class, which I'll get into a little bit later on. Getting your vision and hearing checked, checking your home for fall hazards, using those assistive devices, watching out for your pets, and even outdoors, watching your surroundings, checking those sidewalks, and really just investing in yourself. Join that fall prevention program. In every topic up here that has a little asteroid will be covered in our future Wellness Wednesdays. So those are topics to look forward to. All right, so what do we have to offer regarding fall prevention? Just recently, we completed our very first Zoom Matter of Balance. Our master trainers, Jessica and Samantha, they ran that class, and I believe one of the participants in that class is in this meeting, so that is awesome. And it is an evidence-based program designed to reduce the fear of falling and increasing the activity level. So it was it consists of 9 2-hour classes, a very small group, 8 to 12 people. There's very light exercises, and you're just talking through a lot of different scenarios and coming up with ways to help prevent falls. So if you're interested in that, please call our office, and hopefully we will have another session started up soon. And then we also have our new Dignity at Home Fall Prevention Program. Through this program, we provide in-home assessments. So we go into the home and we assess if the client needs grab bars, shower chairs, different things like that. But we're also assessing your kitchen rugs. Do they have the little stickies on the bottom? Just doing a full in-home assessment to help you become more aware of different fall hazards inside your home. And then we also provide some fall prevention education at that home assessment. And then, of course, if recommended, providing those injury prevention accessories such as grab bars, shower chairs, handheld showers. And there are a few program guidelines for this program, as I listed right here on the slides. At least 60 years of age or disabled, be at risk of falling or have recently had a fall, and then some monthly income guidelines, which again, you can call our office if you need a little bit more detail in that. This is a really awesome program. It started during the pandemic. But we've had a great turnout so far. All right, and some of you are in our Young at Heart strength training class, but for those of you who are not, we are currently doing it on Zoom. As you can see, our instructor right here in this top photo, she is teaching away on Zoom. So we use a rubber resistance tubing. We do have 4 different levels of resistance. Each class is an hour long and meets 2 to 3 times a week. In these classes, really, we focus on strength, balance, and flexibility to reduce that risk of falling. And like I had said, right now, they are all on Zoom due to the pandemic, but hopefully we'll get back in that community soon enough. Mm-hmm. All right, and we also offer Tai Chi for arthritis and fall prevention, working on balance, confidence, and muscle strength. And right now we do have that on Zoom as well. It's offered on Tuesdays and Thursdays with our instructor, Stephen. It's 11 a.m. to 12. So if you are interested in joining any of these Zoom classes, feel free to contact our office and we can get you signed up in Zoom. All right, so overall, just in summary, I just wanted to kind of sum it up. When we talk about why it's so important to review our medications, it's because multiple medications can increase your risk of falling. It's really important to know the dose and the reason that you're taking a medication. It's okay to ask your doctor, why do I need this, or what are the side effects? And just reducing the side effects that cause from those medicine that can cause a fall. So it's really important to go in depth with your doctor about your medications. And then over here on the side, I did kind of put together all of those programs that I had briefly touched on. Again, contact us at our office or send us an email and we can answer any further questions that you may have regarding those programs. And we would love to invite you all to our next Wellness Wednesday. It will be held on June 30th at 2 p.m. again on Zoom from the comfort of your own home. And we'll be talking about exercise and how it is related to preventing falls. So at this time, I would love to open it up. If anyone would like to unmute themselves and ask me, Dr. Bob, any questions, please feel free.
Hi, my name is Diane.
Hello, Diane.
Hi, I'm 70 years old. I've had 2 falls within the last 8 months. The last fall was just Sunday. I tripped over a 3-inch lip of concrete and at my daughter's house, and she's lived there for 10 years, so I'm very used to her home. But it's like I'm wondering neurologically, do I need to have a workup? I'm not on any medications other than supplements, vitamin supplements.
Well, Diane, it does sound like you're dragging your feet. You also may, to trip over something that's low. And you also may have some problem with, maintaining balance. And we all notice that as we get older. I mean, there's certainly by 65, 70, 75, you're going to have some reduction in those things and going to need to be more vigilant. But I think if you feel there's been a significant increase in muscle weakness or balance problems, it's certainly worth seeing your doctor about that. Absolutely.
Okay. I tried to be aware of my surroundings and mindful. For some reason, the 2 falls, it was like I had something else on my mind and I was in a hurry. And so I tripped over a concrete barrier, and Sunday it was over just a raised concrete that I was trying to get to a garden hose that was running water. And it's just like I've taken the Healthy Aging Strength class, and the falls occurred since COVID, since I haven't been in the classes and I haven't done them on Zoom. So,
well, Diane, one thing to consider too is taking the fall prevention class that Healthy Aging offers, because they really, you can really analyze this in more depth. As well as you said, it's absolutely true that the more that you exercise on your feet, whether that's walking or doing the Tai Chi has been shown to reduce falls. It makes sense because you're just standing on one foot and that kind of thing. That those are really going to help. That's what you can do positively to help. Absolutely. And most of us do drag our feet more as we get older, and sometimes it is a beginning issue of certain diseases. Parkinson's comes to mind. Not saying you have it, don't want to scare you, just saying that but certainly at least getting screened by your physician also makes sense.
Would I start with my primary care physician or a
Yes, I'm a family doctor. I strongly believe in going there first.
Okay. All right. Thank you, Dr. McGrew. I appreciate it.
You're welcome.
Any other questions? Comments? Is that all we have for today?
I got a question.
All right,
Sure.
George.
Wellbutrin, how
Yeah.
bad or good is it?
Well, Wellbutrin is one of those medications that tends to be more energizing. Typically, it's not sedating, but again, you can never say never. Just like the one person in 20 years that I've met who gets sleepy on Claritin is my wife. I've talked to hundreds of people about allergy medications. Same thing with Wellbutrin. It's conceivable that you can feel a little bit, have reduced awareness of surroundings, when it peaks or feel sleepy. But we usually would tell people to take it twice a day, and often take it morning and afternoon because people were feeling a little bit energized at night. How do you feel with it?
I'm not taking it at the moment, but I've taken it in the past.
Right.
And I don't know about energizing, but it helps me. But then I sort of feel kind of after effects, like I'm a little clouded thinking wise,
Okay. Right. So that
that's
I think
that's almost all drugs for me.
well, it's such a great question because because drugs affect people different ways, and if you're feeling that cloudiness, that means you are a little bit impaired at that time, in terms of balance. So you really have to very carefully consider whether it's worth taking. It's an antidepressant for other people who maybe don't know that. Usually used for depression. So yeah. And again, one thing that you sometimes can do is to talk with your doctor about dosage form. So we certainly move some blood pressure medications, which I didn't have time to discuss. Our medication like Wellbutrin, if people were feeling like, hey, this makes me a little drowsy, I think I feel a little bit off after I take it, we try to move those to nighttime. And because you're in bed, but the problem with being older is you get up to go to the bathroom. So you still have to watch out. How do I feel when I get up? If I'm kind of feeling fuzzy, then that's a major danger for falling. Can't tell you how many people we had fall on the way to the bathroom at night and come in banged up.
I haven't done that yet.
Okay, well, best wishes.
Another drug I'm taking currently is Alpernol for uric acid for gout flare-ups to prevent.
Oh, uric acid. Say the name again. I didn't catch that.
Alpernol. I don't know if
allopurinol. Yeah, it's called allopurinol.
Yeah.
Right. Yeah. Now that one is not typically thought of as one that makes you sleepy. And it's hard because what the pharmacy gives you when they give you something about drugs is when they give you the side effect list, they normally have about 300 side effects, and they really are just listed. They really typically are just complaints that people had, and we don't really know whether the drug causes them. So it's really difficult when you're looking as a layperson at these things. But I have a medical website that I go right to on my phone. So I'm going to that particular medication and don't see it listed as a greater than 1% side effect. Don't see any neurological issues typical for that. So well, wait, let me come back. I'm sorry, I went past it. For that medication on this website, which is the best information I have, it's listed as a less than 1% side effect of feeling sleepy or a little confused. Less than 1%, so pretty unlikely.
All right, thank you.
All right, any other questions?
Well, thanks for staying on, and hopefully you can maybe be of help to friends too. Friends and family often, you can recognize potential issues.
What is that website you looking on?
Dr. Bob, what was the website that you were just searching for that
Oh,
medication on?
It's a $500 a year physician website called Up to Date.
Okay, thank you.
But WebMD is free, and it actually is very good. WebMD, WEB, WebMD.
Familiar with it.
Yeah. Well, thanks everyone for coming, and we really great to see you.
Just want to thank everyone so much for joining our very first Wellness Wednesday. I think it was a great turnout, and we really hope that we'll see you all next month for discussing exercise. And just a reminder, this will be recorded and posted on our Facebook page along with our YouTube channel. So thank you all so much for coming. We really appreciate it, and we'll see you next month.
Thank you.
Bye.
Thank you for
Bye.
having us.
Thank you. Bye-bye.
Thank you.